crux of the issue is people who start smoking when they're youth, when they're not making the same decisions as they're able to make as adults, and they're very vulnerable to some of the kind of marketing techniques. And once you've started, it's very hard to quit. One threat is that people think, oh, well, we've got this under control. It's not a priority anymore. And yet that really should be the case. We should have sort of eliminated this by now, but we don't. It is sort of surprising to me, the fact that our society tolerates industries making money off of things that are clearly harmful to people. And I mean, that's why you sort of manage to get one thing under control and then something else pops up. Hello, everybody. I'm Dr. Marcus Plescia. I'm the Chief Medical Officer at the Association of State and Territorial Health Officials, and you're listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. From PHI Media, I'm Gordon Thane, and this is Public Health Policy Issues to Watch in 2024, Episode 226, Overdose Prevention and Proliferation of Nicotine Products. Tens of thousands die by opioid overdoses every year in the U.S., and drug policies are slow to evolve to address the modern-day challenges. Big tobacco manufacturers continue to find ways to introduce young people to addictive nicotine products, hampering all the progress public health has made towards reducing smoking over the last several decades. It is perhaps no surprise that opioids and nicotine products make ASTHO's top 10 public health policy issues to watch in 2024. What you'll hear in this episode is the final chapter of our conversation with Dr. Marcus Plescia about the chronic nature of addiction and the importance of addressing social determinants of health. The conversation also delves into the successes and challenges of tobacco control, particularly the rise of e-cigarettes. What these issues have in common is that the health outcomes are tied to various policies, or lack thereof. But let's start off with overdose prevention and the importance of understanding problematic substance use and addiction as a disease of despair that is strongly linked to socioeconomic disparities. I wanted to get a flavor for how that priority unfolds, given that that's something that we've been chronically struggling with for the last decade, 2 decades now, and there's different phases of this opioid crisis. And now drug policies are getting talked about more and more. So maybe situate us with the scale and magnitude of what we're dealing with in the United States in particular, and the various policy options that are being explored in that domain.
Yeah, this continues to be a huge problem, and it just sort of got overshadowed by the pandemic. And, everybody had to take their attention away from it, and I think it only got worse. There's a couple of things about this that I think are important. First of all, when this first started and we were all working on it, we talked a lot about opioid overdoses, and addiction in general as this term, a disease of despair. And I think there's something to that. If you look at where the rates are highest, they tend to be in more socioeconomically depressed places. You see a lot of addiction going on out in rural areas where they've lost their jobs, and things are kind of desperate, and people are having a hard time finding their way, and they begin to feel despair, and they turn to other things like drugs. But I think we need to be a little careful with that also, because the other thing that we've learned, and I think has become more accepted, is that addiction is a disease. And so when people cross over into that, first of all, probably some people are more prone to develop a problem with addiction than others. It's just like a disease. Some people are more likely to get diabetes than others. And I think that's one of the other things that we've made some real progress in beginning to understand that. And the problem with it is it's a disease that once you contract it, it's lifelong. People who have addiction, they can become drug free, but they've always got that potential danger that they could go back. And I mean, we've seen that for a long time with alcohol addiction. It's the same with many of these drugs. So I think we've got to sort of deal with those two things. Clearly, I think there is a kind of systemic problem that there is so much disparity in our nation across all kinds of reasons. And for people who are really at the bottom end of that disparity and are really feeling it, I mean, that's where we're seeing a lot of these problems with addiction pop up. And the only way to fix that is to deal with some of the broader social issues and give people some hope and make sure they have skills where they don't feel desperate, and look at some of these communities where there's not much opportunity. Figure out how to bring. It's easy for me to say this. These are hard problems to fix, and we're not. As far as socioeconomics, I mean, I don't know that our nation, the United States, is really going to get to a place of equity anytime soon. But it's become so disparate that's what I think. If we could address that, we could make some differences, both with the sort of more despair side of it. There's been a lot of work around understanding that addiction is a disease. This idea that we've got to kind of deal with some of the stigma that goes to it with it, that deals with how people get treated, but also how they might seek care. I think we've made some progress there. But what's concerning to me is we only fix it if we're only able to help people once they're addicted. Well, most of them would rather have not gotten to that state. And how do we go upstream? Goes back to the beginning of our conversation. How do we go upstream and get at the root factors? Mm-hmm. And that's tough. Some of that, there's a lot of interest in ACEs, adverse childhood experiences. And I think there's a lot of potential there. But you're going back and dealing with things in kids, you're not going to see the benefit of that with something like addiction for decades. And the ability to be patient and wait is something that no society is very good at.
Speaking of going upstream and the root causes, one of the strongest levers in public health to address population level challenges is through policy. But just as many policies are designed to bring about positive change, new or existing policies can also have a ripple effect to unintentionally cause harm. This led to the question, what might effective policy options look like for opioid overdose prevention and problematic substance use? It turns out that policies that improve the situation may not directly be connected to the issue that you're trying to solve in any obvious way. In other words, a downstream policy might expand access to drug checking and reduces harm from use without necessarily addressing the reason people use in the first place, while a more upstream policy might address housing, an important risk factor for opioid overdoses and problematic substance use. Dr. Plescia emphasizes the importance of these types of policies, which tackle the social determinants of health. That was a very astute description, because one of the things I struggle with is it is an opioid crisis, it's an overdose crisis, it's a drug toxicity crisis. But when you factor in the root causes of things, it's also a drug policy crisis, a social policy crisis, because that's where the prevention efforts would need to happen to prevent it from becoming a more acute crisis in terms of fatal overdoses, for example. So at that policy level, what are some options in either direction that are being explored? I know on the housing crisis side, that's one component. There's, I think in the paper, drug testing and drug checking, access to that was being expanded. I wasn't sure where the U.S. was kind of going with this in the near future.
Yeah, well, one big policy issue is, we used to call it mental health equity. Behavioral health conditions are equal to physical health conditions. And I think things have gotten better, but sometimes when you're suffering from something that's more of a behavioral health, you have a hard time getting coverage and getting those services or needs or medications paid for. And that's, for me as a clinician, I just sort of think to those things first. And that has gotten into the lexicon, and I think we have fixed some of those things, but there's still opportunities there. After that, I start to really pivot to much broader kind of socioeconomic policies and what we refer to as the social determinants of health. I mean, we have to address some of these things like housing and education, and just, basic income and ability to support oneself. And I mean, that gets back to this, disease of despair theme. We got to, we could take some of that despair away, but those require policy decisions as well. And then there's this even more difficult issue to deal with, which is sort of the legacy of discrimination and racism, and that plays into this as well. And those kinds of policies are where you can get into a lot of contention and people on very different sides of the camp about what should be done. But when you look at the numbers and when you look at who's being affected, it's pretty obvious that we've got to pay some attention to that as well. And I think there's the beginnings of some progress there, but some of that sort of this very volatile kind of political partisan era we find ourselves in, it's making that a very difficult part of the policy piece to really address.
Another public health policy issue highlighted on ASTHO's top 10 list was tobacco and nicotine, with a particularly concerning trend, with the access, availability, and use of flavored nicotine products increasing, especially for youth. Tobacco use remains the leading cause of preventable disease and death, and while smoking rates have declined due to decades worth of public health efforts, the proliferation of appealing e-cigarettes serves as a new gateway to attract smokers. Just how can policies and regulators be responsive to an industry that is constantly innovating new products? And then another component is tobacco and nicotine. And I think this one's particularly interesting because there's been a lot of work done to curb smoking cigarettes for several decades now. And there's been a lot of progress made. Smoking rates are going down for the traditional combustible cigarettes. I think a lot of countries' goals is to get it to that 5% or lower mark and keep it on the decline. So reasons for celebrating, right? But maybe not so much, because there's other different products that contain nicotine that are now a pathway to even going back to cigarettes if they're still available. This is such a bit of an older issue that public health's been dealing with, hot and cold, I guess, in various stages, depending on the arms race between big tobacco finding ways to kind of market products and public health responses to that. So situate us in terms of where we are with the tobacco and nicotine problem in the U.S. right now.
Well, it's a big success story, like you said, because we've come a long, long way from, back when tobacco products first became available, were widely used and people didn't really know that they were bad for them. And we've been able to really hone down on what the kind of crux of the issue is. And the crux of the issue is people who start smoking when they're youth, when they're not making the same decisions as they're able to make as adults. And they're very vulnerable to some of the kind of marketing techniques. And once you've started, it's very hard to quit. One threat is that people think, oh, well, we've got this under control. It's not a priority anymore. And yet that really should be the case. We should have sort of eliminated this by now, but we don't. It is sort of surprising to me, the fact that our society tolerates industries making money off of things that are clearly harmful to people. And I mean, that's why you sort of manage to get one thing under control and then something else pops up. And now the thing that's popped up is electronic cigarettes and all the flavorings that go with them and some very persuasive and effective marketing around those things. And so as long as there's that constant attempt to tempt youth to develop these addictive habits, we're going to continue to be fighting this one. And it's shifted. It's much more about electronic cigarettes, although the problem is that a lot of people who start off with electronic cigarettes then move on to conventional tobacco products, and those are even more harmful. So it'd be nice if we could just kind of cross over and eliminate this sort of major health risk factor, but we're not there yet. And it's all about policy.
Other countries have elected for a more definitive approach, one that is more proactive than responsive. These approaches are in line with the goal that smoking can be eradicated completely, and to do so, more extreme measures are warranted. In particular, New Zealand and Australia have strong policies to eliminate smoking. Is there a reality where the US could adopt such policies? especially when it goes against multi-billion-dollar industries? Well, Dr. Plescia believes that the end game should be reducing the social desirability of smoking and the consumption of nicotine products, especially for youth. Speaking of all about policy, it's interesting that other countries have taken a more progressive approach, like the New Zealand, Australia, to eliminate smoking entirely and eliminate the availability of cigarettes, for example, and then regulating more strongly the availability of electronic cigarettes because it's marketed as a smoking cessation tool, but not in the context of being prescribed by a physician under the care of a physician. It's sort of do as you wish. So some countries have taken a stronger approach on the policy side, where others like Canada and the US maybe aren't quite there yet. So do you envision a future where we could get to a point where cigarettes are just not available for young people anymore, or young adults?
Maybe, but I think the big thing is, and I think what they're doing in those other cultures is they're changing the social norm. It's not so much that they're making it illegal and it's criminal to go and smoke, because we all know that that's difficult to enforce and really make out. But what we have is this norm where not only is it not illegal, but it's being framed up as being kind of sexy or cosmopolitan or cool if you. And I think these countries to say you can't smoke. If you want to go smoke, you're going to have to go huddle off in a corner in the rain. I mean, there's nothing sexy or fun about that. And so the social norm changes and it becomes something that's not really accepted by society for people to participate in. And that's, I think, where we get at it with tobacco use. And probably there's always going to be a small proportion of people who use tobacco products, but we can get to a much lower amount. But there's always this thing of like, we're trying to criminalize it, or how are we going to enforce it? It's like, well, that's not really what's going on here. We're trying to change the social norm around what this is and what it means and how people should view tobacco use in our society. I do think we can get there, but it's just an ongoing fight right now, because every time you sort of get one thing, sort of sort the norms out, something else pops up that can be marketed and was fun and sort of appealing to, and mostly it's again to young people.
After touching just the tip of the iceberg with the present day challenges of overdoses, overdose deaths, and the access and use of nicotine products by young people, Dr. Plescia takes a step back to share his perspective on the work of public health from a 30,000-foot view. He encourages young public health professionals to focus on reducing inequities and emphasizes that public health should seek to ensure that everyone, regardless of race or background, has equal access to good health.
One of the things that really attracts people to public health and motivates people in public health is this issue of addressing the disparities that we see in health. And I just wanted to speak to that a little bit. I mean, I think that's the thing we can't ever lose sight of. And even when things get discouraging and even when the environment isn't allowing progress to be made, I think it's just really important to be supportive of that work. And, I think for somebody like me who's kind of further up in my career, to sort of say, we need that fire coming from people who are younger and getting started. And it can be discouraging. It can make people angry that we still deal with these problems. But it's just something we have to persevere with. And I found that what's nice about public health is you can talk about reducing disparities, which I don't see how anybody can really object to that. A person who's just like me as far as wealth and profession and education, but who happens to be Black, their health shouldn't be worse than mine. They shouldn't have worse access. I think we have some real opportunities to find common ground on that. And so I just encourage, and I've tried to work on that particular issue throughout my career, and I hope I've been helpful. I don't think I've done anything that's sort of groundbreaking. A lot of what I've tried to do is mentor and help other people who are coming up and interested in this topic think about how they can be effective and build that into their career. But I hope that will be, I don't hope, I know that's why people go into public health, because they care about that issue. And I just want to kind of say something affirming about that at the end of this interview. That's if you're getting started right now, keep your eye on that ball. That's the thing that's where we really make the big difference.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.